invitation far and wide, so we're not actually sure who is here with us right now. So we're just going to give a brief introduction to Pathways to Education if you are a guest from far away and don't know who we are, and Dr. Rowland is going to introduce KCHC as well. So Pathways to Education is a nationwide program that works in low-income and marginalized communities to empower students to move on through high school to post-secondary education. So in Kingston, we work in the north end of the city in Inner Harbor and Rideau Heights, which are the two northernmost neighborhoods in town. And we work with about 300 high school students a year to make sure they have the tools they need to succeed in school and work and life. So we are part of Kingston Community Health Centers, and part of our role is health promotion. So this is why we are hosting this evening. And we're really hoping that there are some Pathways students and families here, or some community partners that work with our students that can make sure this information gets to them. We want everyone to have all of the evidence-based, scientific, reliable data that they need before they go and get their vaccines when it's their turn. So that's sort of it. It's pretty relaxed. I'm going to pass the pretend microphone over to Dr. Rowland, and she's going to tell you a little bit about herself and then get right into the presentation. Go ahead, Mary.
Yeah, thank you. So thank you, Ellen, and thank you, Roger, for inviting me to speak tonight. My name is Mary Rowland. I'm a family physician. I work in the primary care clinic at Kingston Community Health Centers. And for people who don't know, the Community Health Center is a fairly big organization in Kingston. So Pathways is one part of it. We offer primary care services as well. There's a dental program, we have street health, we have immigration services, we have early on, we have community development, we have lots of different programs to serve the community, primarily Rideau Heights, but also other equity-seeking populations of various kinds. So lots of services. But my role is in the primary care team. So I'm a family doctor. I provide care to patients from babies all the way up to elderly people and everybody in between. And I've been at the health center for about 10 years. And so I've been actively working in all things COVID in Kingston right now. And so I gave a talk several months ago when our staff were being invited to be vaccinated, just to answer people's questions and provide some information about vaccines. And the Pathways staff, as they've been talking to their families and clients, are also finding that lots of people have lots of questions and need good information. And so they asked me to come and share some of the same information tonight that I had shared with our staff several months ago, as well to be available to answer questions. So I'm hoping it can be interactive. Like Ellen said, I have about 25 minutes worth of slides just to provide some overview and answers to questions that I get a lot from my patients, because I'm making phone calls and seeing visits of people every day and talking to them about COVID vaccines. So I'm going to share some of the questions that I've had a lot of, and then there'll be time at the end for people to ask their questions as well and put them in the chat, put them in the Q&A, all of that kind of stuff. So just give me a minute. I'm going to start sharing my screen and hope that works properly. Does that look right, Ellen?
Yep, it's good to go, Mary.
Okay, perfect. So just this first slide is just to acknowledge that it is confusing. And so if you've read lots of vaccine information and you're not really sure what it means, you are not alone. And even if, even if it seems like it's trying to share information clearly, you can still read it and be confused. So if that's you, you're in good company and you're not alone. Here's what we're going to talk about tonight. We're going to talk about why should I get vaccinated? How do the vaccines work? Are they safe? What are the possible side effects? Who can get the vaccine? And if you want the vaccine, how can you get it? So that's where we're going with this talk. And again, just to acknowledge that it's okay to have concerns. And that's what this conversation is all about. And just listed there are some of the things that I hear fairly often from people on the phone and in my office. Worried about things being experimental, that the approval process was rushed, worried about side effects, what's the long-term data, will it change my DNA, things like that. So hopefully we're going to cover all of that stuff tonight. I just wanted to share this graph. I promise it's the only graph in the presentation, but I thought it was good to have a sense of where have we come so far in the pandemic. And if you look over on the one side, that's January, and you can see the first wave is really small. The second wave was bigger. Now we're over at the far side where we're in the third wave. And the reason I share this is because The whole point of being vaccinated is so that we don't have an even bigger fourth wave. That's what this is all about, and trying to stop this pandemic from continuing the way it has been. So here's a couple of things, and we're going to circle back to all of these reasons, but why should I get vaccinated? So COVID has affected so many people, and as we know, the third wave has been even more serious and deadly than the waves before it. So vaccines are the way to help us end the pandemic and get life back to normal, which is what we all want. Your community is counting on you. The vaccines are the best way to keep healthy, and in order to keep your family, your friends, and your neighbors healthy. And finally, getting vaccinated will protect your own health. It's the best way to keep yourself alive and out of hospital. So this is a picture that just explains vaccines in general. So this is not just specific to the COVID vaccine. This is all vaccines and how they work in the body. So a vaccine has either a little piece of the germ we're trying to protect against, or the whole germ itself that's been killed off, and that gets injected into the body so that the immune system, which is your body's protection mechanism, can learn what the germ is and learn how to fight it, learn how to mount a response, those antibodies that look like the letter Y, so that the next time the body's exposed to the germ, it already knows what to do. It already has a way to fight the germ off to keep yourself healthy and not get sick. The other point that I want to make is that we know that vaccines work. So vaccines have been our friends for a long time. And on this slide, we can see some of the diseases that used to be really serious diseases for kids and adults that used to kill lots of people every year. And now we have vaccines for them. And so we don't worry about our children dying from polio or dying from diphtheria, even though they used to, because vaccines have been around for a long time. Vaccines are our friend, and they're the best way to fight infectious disease. So we need to keep that in mind, that we know vaccines, we know how they work, and we know that they're safe and effective. Another question that I get a lot of is, what is herd immunity? So this is a term that you might hear around quite a bit. And I found this really great video. It's only 1 minute long from Health Canada. And so I'm hoping that this is going to work. And it just explains the concept of herd immunity. So we can watch it together. Here we go.
Immunizations protect your child from diseases and help stop the spread of certain diseases in your community. When more people are immunized, less people get sick because the disease has less people to infect. If you don't have the disease, you can't pass it on. Some people can't get immunized. Ensuring that your loved ones are fully vaccinated will help protect the whole community, including those that can't be vaccinated. This is called herd immunity. So, when no one is immunized, contagious diseases spread in the community. When some people are immunized, certain diseases can still spread to those that are not protected. When most of the community gets immunized, very few community members will get sick, thanks to herd immunity.
Oh, got to figure out how to advance my slide here. Sorry, guys. Oh, there we go. Okay, so just to review the main benefits of getting the COVID vaccine. Number one, you'll be protected against COVID-19. Number two, you'll be protected against serious illness and death. And number three is you're much less likely to give COVID-19 to anybody else. So one of the questions I hear most often from my patients is, how did we possibly get a vaccine so fast? It can't possibly be safe. They must have rushed it or skipped a safety step. So I just want to share some information that was put together by some physicians in Toronto, just to explain how is it possible that we got the COVID vaccine so fast. So we're going to spend quite a bit of time on this because I find that this is where a lot of the questions come from. So the first point is that COVID-19 is not a completely new kind of virus. It's similar to other coronaviruses that have been around before, like the SARS virus, and those viruses have been extensively studied. The other thing is that the technology to make the mRNA virus has been used before. So it had already been developed and investigated for other things. So when COVID came along, they just had to plug a new virus into a technology that was already there. Some other things to consider are that there was lots of people around the world working all at the same time. And as soon as they identified the genetic material from the virus, it was widely shared and made public so that lots of different researchers could work on it all at the same time. There was lots of funding for it. Things were going on in different places all around the world, and lots of it was being shared in a way that has never happened before. The other part of it is that so many people volunteered for testing. A vaccine can't get approved for use in humans until it's been tested on a large number of people. These tests are called clinical trials. When COVID came along, because the pandemic was such a big deal, there was a huge amount of public support for clinical trials, and it was thousands of people that volunteered to be in the testing. The other thing that was happening at the same time is because there was such a high rate of COVID infection, it made it really quick to test the vaccine because it was quite quickly apparent that the people who had the vaccine didn't get sick compared to people who hadn't. And that can only happen in a scenario where you have lots of volunteers as well as a high number of infections. So that was the case for COVID. And then the last piece of the puzzle is the approval. And the approval process was able to happen quickly because Health Canada and other health approval organizations were reviewing the data at every stage of the game. So often with vaccine approval, you wait until the whole trial is finished and then submit for approval. With COVID, because it was an emergency, data was being submitted at every step of the game so that by the time the trial was finished, the approval was ready to go. So this slide just summarizes. On the one side, you can see the process for vaccine approval in Canada. And just to reiterate, none of these steps were skipped in COVID. They were all completed, but at a quicker pace than is usual for vaccines because of the factors that we talked about before. Okay, so now we've talked about why it's important to get vaccinated. We've talked about how the vaccines were developed so fast and that no safety steps were skipped. So now I just want to review what are the different types of vaccines, because you'll hear lots of words around and it can get confusing of what they all are. So there's two different types of vaccines. There's the vaccines that are mRNA vaccines. Those are the ones like Pfizer and Moderna. We have a lot of those in Canada. So the Pfizer vaccine is the one that you can get at KCHC, so our clinic on Weller. It's the same one that healthcare workers in Canada have gotten. It's the same one that public health is offering at the Invista Clinic and the Strathcona in Napanee. And it's the same one that they're giving at the hospital at Kingston Health Sciences. So all of those places are offering the Pfizer vaccine. There's also the Moderna vaccine, very similar to the Pfizer vaccine. That one is a little bit easier to move around. So some of the mobile outreaches like Wolf Island and different places are using the Moderna, as well as the clinics that are being run out of the Memorial Center. So those are the mRNA vaccines. There's a different category called viral vector vaccines, and we're going to talk about them too. And those are things like AstraZeneca, which people have heard a lot about, and that's the one you can get in the pharmacy, and Johnson & Johnson, which has been approved in Canada but isn't here yet. So we're going to start by talking about the mRNA vaccines. The way they work is the vaccine contains the instructions for your body to produce a protein that is the same as the protein that's on the surface of the virus. And then your body mounts an immune response to that so that when you see the actual real virus, you're ready to fight it. So the mRNA vaccines don't actually have any COVID in them. They have the instructions for a protein that's on the surface of COVID. So this is just a picture version of how an mRNA vaccine works in your body. The important point to make here is that the mRNA that's in the vaccine doesn't go anywhere near your own body's DNA. So that's something that a lot of people get confused about. And there's a big worry. Do these vaccines change my DNA? Is it doing some kind of genetic modification? Is it going to affect my fertility? What if I'm pregnant? So it's important to understand that the mRNA in the vaccine isn't going anywhere near your body's DNA. So again, all it's doing, You can think of it like a most wanted poster. It shows your body what the germ virus looks like so that your body can recognize it if you actually get exposed to it. All right, now we can talk about effectiveness. How good are these vaccines? They're actually really good. The Pfizer and the Moderna, the mRNA vaccines, have more than 95% effectiveness. That's pretty amazing for a vaccine. Not very many of our vaccines are that effective. The effectiveness was similar across different races, ethnicities, and age groups. And in fact, even more than the way it can protect you from getting COVID, it is almost 100% effective at keeping people out of hospital and preventing death. So they're really effective vaccines. The other point to make is that these mRNA vaccines are very safe. The trials were way bigger than any other vaccine trials usually are, and the safety has been proven. The side effects that most people get are things like a sore arm. It will be very sore for a couple of days. You might have a headache or some body pains and a bit of tiredness for a day or two, and a small number of people might get a fever. If you do get a fever after your vaccine, though, you do need a COVID test because there's no other way to know whether the fever is from the vaccine or if you've been infected in the interim. Again, the points that are important to keep in mind are that the vaccine can't give you COVID because the mRNA vaccines don't have any COVID in them, and they can't give you any other infection. And the mRNA vaccines are not going to change your DNA. The other thing that's important to recognize is that the mRNA that's in the vaccine only hangs around in the body for a couple of days, and then your body breaks it up and it's gone. So some people worry, what about the long-term effects? What's going to happen a couple of years down the road? It's important to realize the products that are in the vaccine only stay in your body for a couple of days. Okay, and what about the long-term effects? How does it work and how does it last? So you do get some protection against COVID about 2 weeks after your first dose. The best protection happens about a week after your second dose. In Canada right now, the decision was made to extend the interval between doses, meaning that you get your first dose and you don't get your second one until 4 months later. That decision was made in order to give the most number of people a chance to be protected, but the best immunity happens a week after the second dose. That being said, the immunity you get, the protection you get 2 weeks after your first dose is pretty good. Nobody knows yet how long the immunity is going to last. We know it lasts for quite a few months, and we've seen that, but nobody knows how long. It's quite possible that in the future, we're going to need booster doses for COVID, similar to how we have to get flu shots every year. We don't know for sure, but that's quite likely the case. It's also true that it does cover the new super spreader mutants or variants, and I'm going to come back to the variants of concern a little bit later on to talk about them too, because people have lots of questions about those. The other thing is that even if you have been infected with COVID, it's still important to get the vaccine because the protection that the vaccine gives you, that immunity is going to last longer than just relying on immunity from the infection itself. Okay. What about the AstraZeneca vaccine? This is the one that's in the news all the time. So let's talk about it. The AstraZeneca vaccine is in that second group of vaccines that are viral vector vaccines. And what that means is they take a virus and they kill it off and they put some genetic information into it and then inject that into your body. That's the way you develop immunity. The AstraZeneca vaccine is approved for use in Canada right now in people over age 30. But in Ontario, you can only get it in pharmacies if you're over age 40. The efficacy of the AstraZeneca vaccine is a little bit less than the mRNA vaccines. It's more like 60% effective, but it's just as good, like close to 100% just as good at preventing death and hospitalization. And when we talk about things like COVID, that's what we're really interested in, is keeping people out of hospital, keeping people out of the ICU, and keeping people alive. So the AstraZeneca vaccine is just as good as the other ones at doing those really important jobs. But what's the story with the blood clots? Because I know that's the thing that everybody really wants to know, and that's what people are worried about. So with the AstraZeneca vaccine, and it's unique to this vaccine, it doesn't happen with the Pfizer and the Moderna vaccines. There is a rare but real small increased risk of a specific kind of blood clot. This blood clot happens between 4 and 28 days after getting the AstraZeneca. And we don't know exactly what the numbers are. The risk is somewhere between 1 in 50,000 people or 1 in 100,000 people that get vaccinated with AstraZeneca will develop one of these rare kinds of blood clots. In Canada, so far, they've reported about 5 cases out of 1 million doses that have been given. It's important to keep in mind that clots related to the vaccine can be treated, and doctors in Canada do know how to identify these clots if they happen. And if the clot happens, people are very symptomatic, so they are aware when it happens and they present for treatment. The other thing to keep in mind is that you have to balance the risk of blood clot from a vaccine with how dangerous the disease that you're trying to prevent is. And so one thing to keep in mind to help us decide about risk is that if you get COVID and get admitted to hospital, about 1 in 5 of those people will develop a blood clot. So 1 in 50,000 if you get the vaccine and don't get the disease. If you get the disease and get admitted to hospital, it's 1 in 5 that can develop a blood clot. So I know humans are not very good at judging risk, and risk is a difficult thing to weigh out. And we tend to be really scared of the really scary things, and that's natural. But for most people, especially in the third wave where the disease is really serious and putting people in hospital and people are dying, the AstraZeneca vaccine for the age groups it's being offered to is still safer for most people than the risk of getting COVID. All right, what about the variants? And what is a variant? I had this conversation with a patient today. So over time, viruses change and mutate as they make copies of themselves. And this is how viruses stay alive, is they make a whole bunch of copies of themselves. And that's how they infect people. And when the virus is in your body, it's always making a whole bunch of copies of itself. And that's how it makes you sick. When viruses are making a whole bunch of copies of themselves all the time, sometimes as they're copying their genetic information, they make little mistakes. That's called a mutation. When a mutation or a mistake that's made in reproduction causes the virus to be more easily spread or to cause more serious disease, then we call it a variant of concern. So this has happened with COVID, because COVID has been around for more than a year now, and it's made millions and millions and millions of copies of itself. And along the way, it has made some mistakes that have caused it to be more easily spread and cause more serious disease. And over time, we've got to the point in Ontario now where more than half of the new infections in Ontario are caused by variants of concern. The one that's the most common here is the B117, which is the one that started in England. The thing to keep in mind is that all of the vaccines we have give protection against the variants of concern. And especially the UK variant, the one that's most common here, does respond to the vaccines that we have. The other thing to note is that companies are already and researchers are already working on booster shots for the vaccines that will include additional protections against the variants of concern now that we've identified them. Okay, here's another question. Who should not get the vaccine? There's only a very few number of people who really shouldn't get the COVID vaccine. If you currently have a case of COVID or you're waiting for a COVID result, you should not get the COVID vaccine until your infection has cleared. If you are a child under the age of 12, you are not eligible for the COVID vaccine. They just haven't been studied in kids under 12 yet. There are trials underway for adolescents and younger children, and I do anticipate that by later this year, the vaccines will have approval in children, but we're just not there yet. Anybody who has an acute illness, which means you're currently sick, you currently have a fever, or you currently have a respiratory infection, that's not the time to get vaccinated. You should rebook your appointment. If you have a history of anaphylactic allergy, so a really bad allergic reaction to a previous dose of an mRNA vaccine or to any of the vaccine components, you should not get the COVID vaccine. If you're not sure if your allergy is to a component of the vaccine, you should talk to your own healthcare provider and find out. Individuals who have food allergies like egg, nut, soy, none of those are contraindication to the vaccine. If you have an anaphylactic bee or wasp allergy, it's still okay to get the COVID vaccine. Anybody who's received a different vaccine within the previous 2 weeks or 14 days should not get the COVID vaccine. And the only reason for that is if you get a vaccine reaction, it will be impossible to know whether it was to the COVID vaccine or the other vaccine that you had. So it's just important to space out your vaccinations. Here's something important to note too, and this is a list for people who have specific concerns. These are things that are not in any of the 4 COVID vaccines. There's no thimerosal, mercury, or formaldehyde. And these are things that are preservatives that people have had concerns about from vaccines in the past. These are not in the COVID vaccine. As I said before, there's no eggs, peanut, milk, or soy or related products in the vaccines. Vaccines do not contain any antibiotics. The vaccines do not contain any venom, so insect venom allergies are fine. The vaccines do not contain fetal tissue, and the vaccines do not contain microchips. These are all things that are being spread. This is misinformation that's being shared out there on social media. The vaccines do not contain any of these things. All right, we're getting to the home stretch. Who can currently get the vaccine in Kingston? So Ontario has a well laid out vaccination plan. Right now, as of April the 27th, we're currently in phase 2 of Ontario's vaccination plan. This means that in Kingston, we have already done all of the residents of long-term care and retirement homes and their staff. We've already done healthcare providers. Now we're working on people age 60 and older, people who identify as First Nations, Indigenous, Métis, or Inuit, people who live or work in congregate settings. So these are things like group homes, homeless shelters, some corrections facilities, places where lots of people live close together. Pregnant women have recently been added to the high-risk group as eligible. So that's new about a week ago. So we're now also vaccinating pregnant women. And then there are some specific medical conditions. So Ontario has laid out a list of prioritized medical conditions for people who should be close to the front of the line for getting a vaccine. So I've listed a few of them there. The full list is available on the Ontario Health website if you're interested. There are more conditions that will be included as the eligibility broadens. But for now, that is a pretty good list of the medical conditions that are eligible at the moment. But as more vaccines become available, more medical conditions will be included. And then at the bottom, I've also noted again, those who are over 40 can get the AstraZeneca vaccine at private pharmacies. So for the public health run clinics, it's age 60 and older. Through the private pharmacies, it's age 40 and older. I'm going to address a couple of things because we had some specific questions sent to us ahead of time. So I want to make sure to get those questions answered. One of the questions was about can pregnant women and breastfeeding mothers, if they're vaccinated, pass antibodies on to their babies? The answer is yes. And that's a good news story. So if you're pregnant or breastfeeding and you get vaccinated, your body will produce antibodies as part of the response. And those antibodies have been shown to be passed on through the placenta to babies and through breast milk to babies. So that's a good thing. So breastfeeding women, pregnant women, definitely okay to get vaccinated, and it can provide some additional protection to your baby. Another question that we had submitted ahead of time was, is it okay to get a vaccine during the Ramadan fast? And I'm just sharing this slide. There is an organization called the Canadian Muslim COVID-19 Task Force, and they have quite a bit of information to share with people about COVID-19. And this is a slide from their website that indicates that, in fact, yes, getting the COVID vaccine is permissible during the fast. And anybody who is interested in other information about COVID and Ramadan and safety could visit the website that's listed there at the bottom of this slide. All right, so if you are eligible now, or if your turn is coming up soon, as it will for every Canadian adult who wants to get vaccinated, you're going to want to know, how can I get the vaccine? So in Kingston, there are lots of different ways to get the vaccine. We've spoken about some of them a little bit already. But if you want the vaccine and you want to get vaccinated at our organization, so at our clinic on Weller Avenue, when it's your turn, there are 3 ways you can book. So if you are an online person, you can go to the website there that's listed for KFL&A Public Health. And in fact, that's a great website to check out, even if you're not ready to book. But again, if you forget who's eligible now, who can get vaccinated, if you forget some of the answers to these questions we've talked about, there's lots of information there on the public health website. And the website is listed there, or you can just Google Kingston Public Health and click on the COVID vaccine button that comes up. So you can do it online. The second way is by telephone. So lots of people don't have email, lots of people don't have internet access. That's totally okay. Even if you just have questions, Kingston Community Health Centers has a COVID-19 vaccine line because we know lots of people need help and support with this sort of thing. So if you need to book and you aren't able to do it online on your own, or you have language issues or any reason why you need a bit of help getting booked, the phone number is there. So that phone number, 613-542-2949, that's the phone number for KCHC. And you can either follow the prompts or you can use extension 1183, and that's the COVID-19 vaccine line. Somebody might answer the phone. If they don't, please leave a message and you will get a call back. So you can do it online. You can call our phone line. The third way is if you live in the neighborhood and you don't have a phone or you don't have internet access or you just need a little bit of help, you can always visit the health center at 263 Weller. We're in the Sunshine Variety Plaza, and there'll be somebody there at the reception desk during office hours that can answer your questions and help you book an appointment. So we really want to make sure that people who are eligible for the vaccine, who want information about the vaccine, who want to book their appointment, that we are providing lots of different ways to get booked and get the information that you need. So hopefully one of those ways will work for you. And then again, at the bottom, just noting that if you're over 40, you can always go through pharmacies too. So you can either visit a pharmacy, call a pharmacy, find out who has appointments available to book. So that kind of concludes the sort of prepared slides that I had. But Ellen, I'm interested to know if people have put any questions into the chat. There's things that people are wondering about.
Why, yes, Mary, they certainly have.
Okay.
Thank you very much for that presentation. That was, I also went to your staff one, and that was very informative, but so much has changed in the last.
It's true.
You really could just keep doing these and we could just keep going to them.
It's true, I know.
Okay, so not too surprisingly, a bunch of the questions cluster around AstraZeneca. So I'm going to start with the other shorter ones first, and then we'll pop back to AZ. So
okay.
The first was a question about folks are hearing that side effects from the vaccination seem to be stronger with the second dose, and they were just wondering if that is the case in your experience or otherwise.
Yeah, so I think that is true. And it's the non-serious side effects, but you will feel worse probably after your second dose. But what I always tell people is that's actually a good sign. That means your body is doing what it needs to do, because what we want is for your body to be building its immune response against this enemy threat. And so when your body's immune system responds to something, you don't feel great. You feel pretty achy. You can actually feel it happening. And so what I say to people is, that means that you're feeling the vaccine working. But it is true. I've had my first dose. I'm not my second one yet, but everybody that I've talked to that's had a second dose does say, yeah, the second dose is maybe a little bit worse. But I think that's a good thing. That means that you're getting that extra protection. It means your body's doing what it should do. But again, I'm talking about the non-serious side effects. So things like headache, fever, you maybe just feel like you have the flu, that kind of thing. And it does seem to be worse with the second dose.
Thank you. Okay. We had a question about where Pfizer was being administered in Kingston, but you answered that. But there was a follow-up question about whether or not it's what's being administered at the Strathcona Paper Center. Do you know? Pfizer. Okay, great.
Yeah. So all of the public health run mass clinics are all administering Pfizer right now. So AstraZeneca is only through the pharmacies at the moment, although there have been some kind of pop-up clinics through primary care. And then Moderna is at the Memorial Center. As we go forward, Pfizer is actually the one that has the most stable and abundant vaccine supply. So over the next few weeks, Dr. Moore just announced this afternoon that Kingston's getting 30,000 more Pfizer doses in the month of May. So as we go forward, it's going to be Pfizer that has the most kind of stable and abundant vaccine supply. And I think that's great. I think Pfizer is a great vaccine.
Awesome. And since we'll go back to AstraZeneca again in a second, but a question just came up that's related, which is about availability of vaccines at pharmacies right now. It sounds like there isn't any AstraZeneca available right now at local pharmacies. Do you have any information on when we can expect the vaccines to arrive?
No, and in fact, public health doesn't either. And that is, interestingly, that is a completely separate vaccine supply chain, and it's direct from government to the pharmacy. So everything else is coming kind of through public health and being distributed that way. AstraZeneca is just direct from ministry to pharmacy, and no one has any information right now about when we're getting more.
Okay, thank you. Okay, so AstraZeneca. Okay.
Can I just add something onto that though? The fact that we're getting 30,000 more Pfizer doses does mean that the age eligibility we will probably see that drop by 5 years every couple of weeks over the next several months. So it doesn't, right now, people are looking for AstraZeneca supply because they're under 60, but they are ready for their vaccine. The fact that we're getting more Pfizer means that age eligibility, we're probably going to see that drop in the next couple of weeks. Just wanted to put that in there.
That's really important. Yeah, everything sort of interacts, right? It's all moving parts. Okay, there was a question. I'm just going to try to I want to do them justice. So is there any data regarding blood clot risk with AstraZeneca after the second shot versus the first vaccination? And is it the same or greater or less?
So that is actually a great question. And to be perfectly honest, I didn't tease that out as a separate issue in my review of the literature. So to be perfectly honest, I'm not sure. And I don't think that anybody actually knows yet, because the rates of the clot that we're seeing in Canada are actually different than the rates that have been seen in other countries. So we may not know that until lots of Canadians are getting their second dose.
Okay, thank you. More on AstraZeneca. So if I received AstraZeneca as my first vaccination, can I get Pfizer or Moderna for my second?
So right now, that has not been approved in Canada yet, and there's definitely lots of chatter about this too. So right now, no. We don't know in the future if they're going to be mixing and matching vaccines. There is some thinking that maybe that might be a good thing to do, that might increase protection. But what I would say is that, this is not hard and fast, but if you tolerated AstraZeneca well the first time, it's quite likely that you're going to do fine the second time as well. But we just don't know. But right now, they're sticking with the same vaccine. So if you got Pfizer for the first one, you're going to get Pfizer for the second, and same with AstraZeneca. That's the way things are now. But like Ellen said, with COVID, everything changes quickly. Who knows what the National Advisory Committee on Immunization is going to decide about that one. People are definitely studying it to see which one gives the best immune response. But right now, they're saying stick with the same vaccine that you had for the first dose.
You've set me up with another good segue, which is about best immune responses. And is there anything about AstraZeneca that might make it a better protector against COVID versus other vaccines?
A better protector?
Yeah.
Well, right now there's no evidence of that, but the virus is mutating all the time, and so effectiveness of the AstraZeneca that was measured is it was measured in sort of with the original COVID, and so we don't actually have the data for all the different variants. We don't know if maybe some of the new variants AstraZeneca is going to turn out to be better. It's quite possible. So right now that's not the case, but COVID is a constantly moving and changing thing. So we don't know.
Okay.
I wish I had answers to a lot of these questions, but a lot of it's a very interesting time that we're watching science in real time, which we don't often get the opportunity to do. And for those of us who are really into science, it's quite amazing. But it does mean that information is always changing, and so some of these answers we really just don't have yet.
Okay. And to whoever asked this question, you're anonymous, so forgive me if I don't ask it properly, but the question is, can someone with low defenses get vaccinated? And I think that might mean low immunity response.
Yeah, so that's a great question. And the answer is yes. So even people who are actively receiving chemotherapy are in fact encouraged to get vaccinated. The only thing to be aware of is it's possible for people whose immunity is low for reasons like they have cancer, they're on drugs that are suppressing their immune system. It's possible that they may not be able to respond to the vaccine quite as well, but the vaccine is not dangerous to you. So it's all of the specialist organizations are still recommending, yes, please get vaccinated, because any protection it does provide is helpful and beneficial, but there is a chance that you may not be able to respond as well as somebody whose immune system was healthier. But yes, absolutely. People who are immune suppressed or whose immune systems are not as good as other people's are definitely encouraged to still get vaccinated. If you have any worries about that and whether it's appropriate for you, please talk to your own healthcare provider or call the vaccine line. But yes, in general, absolutely.
Great. Okay, I have one more. People are hearing that the COVID-19 vaccines don't stop vaccinated people from transmitting the virus. When you say getting the vaccine makes you much less likely to give the virus to someone else, is there data to support this?
Yes, there's data to support it, but it's not 100% effective, right? So if you are vaccinated, if you get exposed to the virus, you may carry it while your body fights it off, and you're not going to get sick or infected, but it is still possible to transmit it to others. Or you may become infected at such a mild case that you're not aware you're infected and pass it on to others. So there have been cases of fully vaccinated people who have become infected and have transmitted, but it's way less likely in somebody who's vaccinated than in someone who's not. And that's the reason why the instructions for people who have been vaccinated are still the same as people who haven't been. So even if you've received your vaccine, even if you've received 2 doses of your vaccine, you still have to wear your mask, wash your hands, socially distance, practice all of those measures, because it is still possible that even being vaccinated, you could pass it on, but it's way less likely after you've been vaccinated than somebody who hasn't been.
Okay, thank you. So that covers all the questions that people put in the chat while Dr. Rowland was presenting. Are there any other questions that have come up? You can raise your hand and turn your mic on, or you can pop them in the Q&A. This is my first time doing this, so I don't know how long I wait, but Mary, you did say that you had a couple more frequently asked questions that you might want to bring up, unless you covered them all in answering those.
Yeah, no, well, I mean, one thing that I hear a lot is, well, I'm going to wait. I think I'm going to get the vaccine, but I just don't want it yet. And I think I'm going to wait and see what happens. And while people are always entitled to make their own health decisions, I do really encourage people not to delay, because what we've seen with this third wave of COVID is that once a variant takes hold in a community, it spreads so fast that you won't have time to change your mind and book your appointment if the situation that you're living in suddenly changes. So right now in Kingston, we feel a little bit safe, although we shouldn't, because we're in the orange zone now. But that could change at any moment, and one big outbreak could really change the risk exposure in a community. And so I really encourage people, if you're eligible, please don't delay your vaccine appointment, because from the time you get vaccinated, it takes at least 2 weeks for you to be really protected against the infection. And we can't predict what's going to happen in our community over the next 2 weeks. We hope things stay the way they are and continue to improve, but we just don't know. And so people who think they're probably going to get it, but just don't feel ready to get it yet, I really encourage them, please don't delay. Every day that you wait, you could be putting yourself at risk. And so I really encourage people, if you think you're going to get it, just go ahead and get it at the time that you're eligible. The other thing that I often hear is, well, yeah, I'm going to get the vaccine, but I feel like there's other people that need it more than me. And that's something we heard a lot, especially earlier on in the pandemic, but I'm still hearing it now from some people. And what I would say to that is, if it's your turn, if you are really eligible now, that's because you're at higher risk for whatever reason, whether it's based on your age or your medical conditions. So if you are eligible and you meet the eligibility criteria, that means it is your turn. And you're not doing anybody any favors by waiting and letting someone else go ahead. That's just not how this works. And so if you are eligible and you really are, then don't wait and feel like you're kind of doing something good by letting somebody get a vaccine ahead of you. Just go ahead, book your appointment, get yourself protected, protect your family, protect your friends and neighbors. It's the right thing to do.
We have 2 more questions.
Mm-hmm.
So first is, do we have any extra doses at the Weller Avenue Clinic at the moment?
So we have appointments available for people who are eligible. There's only 3 appointments available on Friday, but lots for next week. So if you meet the eligibility criteria and you need help booking, please give us a call. We have, and going forward, we've got appointments available. We have a steady supply of the Pfizer vaccine. So people who meet the eligibility, who are sort of the target population for us in our clinic, then absolutely, we have Pfizer for you.
I just realized that I missed a question, so I apologize to whoever asked it. It was an eligibility question about being a caregiver for an elderly person, like a primary caregiver for an elderly person. Are you eligible for the vaccine?
Yes, if you're an essential caregiver for a homebound elderly person, then yes. So each of those people is allowed to designate one essential caregiver who is eligible for vaccination.
Okay, excellent. And then we have another question. What about diverting vaccines to hotspots, as we are not one of those?
Yeah, so I definitely support the diversion of vaccines to hotspots, and the government is catching up with that and is doing that. And that is the reason why 30,000 sounds like a lot of vaccines, but that's actually already factoring in diverting to hotspots. And so we are not being allocated as many as other communities are. And I think that's the right thing, right? I think the vaccine should go to where there's lots of infections. And so again, you know, Dr. Moore has been a leader in the whole COVID vaccine rollout, and we've been really lucky to have him. And he's sitting at the provincial sort of rollout tables. And he is in favor of diverting to communities where the vaccine is needed, where the infection is highest. And so the amount that we have, I think, is going forward is going to allow for that diversion of vaccines. And I agree. I think that that's the right thing to do.
Thank you. We have another question. So is it up to us to book our second shots after we had the first one, Pfizer, 8 weeks ago, or how do we get it?
So this is somebody who has already been vaccinated?
It sounds like yes, first shot's happened and second shot is pending.
Yeah, that depends a little bit on, so it's a little bit tricky to answer that question because it depends a little bit on where you got your first vaccine. And so, you know, if it was in a pharmacy, those doses haven't been booked yet. If it was through the hospital because you were a high risk patient there, those appointments have been booked. So it a little bit depends on where you received it. If you aren't sure, you can call the public health COVID vaccine line and they can help clarify for you whether you should already have your second dose appointment or not, because some people have them and some people don't, but it depends a little bit on what you received and where. So I'm sorry, that's not super helpful, but if you're not sure whether you should have your appointment or not, you can call public health and leave a message and they'll get back to you.
Okay, thank you. Just not trying to sound distant, I'm just checking to make sure I have everything.
Yeah.
Okay, I think please ask more questions if you have them, because we have Dr. Rowland for another 10 minutes and we can always, you know, end early, but if you have questions, we'd love to give you the chance to answer them.
All right.
Okay. Any other parting shots? For your audience, Mary, anything you want them to know that you haven't covered?
No, I just think I'm so glad that lots of people joined us tonight. I think that's wonderful. I'm glad that we have some staff joining us too, so that they can share great information with our clients. Thank you for coming. And yeah, I mean, I guess one thing would be sometimes it's hard to know where to get good information about things like this. And because we've shared some good facts and stuff tonight, but things could change over time. So I just want to make some suggestions about places you could go and where you could look for information going forward about COVID-19, if that's okay. So a great thing is that, like I said before, the public health website, they update their stuff all the time. So Kingston Public Health is a good place to look for what is the eligible groups now or what's new information about this. The other place is an organization called Science Up First. I think they're great. They're on social media. You can follow them on Twitter. And they are always sharing new things, new data, and it's always evidence-based and really helpful information. So I would say Science Up First, Kingston Public Health Ontario is another place, and Health Canada, of course. So if you're looking for multilingual resources, so maybe some information or FAQs in different languages, then I would say Ottawa Public Health is a great place to look because they have translated almost all of their COVID resources into a whole bunch of different languages. So that's another great suggestion. So those are my kind of top picks for places to go for reliable information, and share it with your friends too, because there's lots of misinformation out there and lots of people that have questions. So I would say talk it up with your family and friends. Anytime you're talking to somebody, ask them, have they got their vaccine? Are they planning to? And see if you can address some of the maybe misinformation that's out there, because we need everybody's help right now.
Okay, thank you so much. Sorry, there's all these nice thank you messages in the chat that keep pinging over there. Thank you so much for coming. We will do this again. We're going to, as to when, not really sure, but we will. And if you want to follow us on social media, Twitter is @P2E Kingston. Same on Instagram, and on Facebook, we're on Kingston Pathways to Education. You get more information on our next event. And I think that might be it. I've put the websites for everything Dr. Rowland just mentioned in the chat. This has also been recorded, so we will post the recording somewhere accessible for you if you want to share it with your friends. And then we will have another event sometime in the near future, I hope. So if there's nothing else, no more burning questions. All right. Thank you so much for coming. We're so grateful that you took the time to spend about an hour of your evening with us.
Yeah, well, thank you so much for having me. It's been a lot of fun.
All right. Oh, wait, I have a thing. Wait, there's somebody. Oh, outstanding presentation, Dr. Rowland. Great content, great style, and a great community service. We're going to end on that note. Thank you.
Sounds good.
Right. Okay. Have a good evening, everybody. Goodbye.